New Omicron variant sweeping across the country. XBB 1.5 now accounts for more than 40% of the new COVID-19 infections.
That's right. It's spreading even more rapidly here in the Northeast, accounting for roughly 75% of cases. And we're already seeing a rise in hospitalization. So to help us understand what's happening right now, we have NBC News medical fellow Dr. Akshay Syal joining us now. Dr. Syal, I mean, this already sounds daunting, like XBB as a name. I mean, how does it compare to those other subvariants?
So XBB, it's a derivative of Omicron. So, for the last year or so, every variant that we've had so far has been part of this Omicron family. Now, XBB is a little bit different than the BA4, the BA2, the BA5 that we've heard about, because the worry is that it can actually dodge some of the antibodies that we've gathered from infection, from vaccination, or both. And so that's really what we're watching for. Because we have a variant that can evade that immune response, will we start to see a rise in cases? Will we start to see a rise in hospitalizations and deaths, especially coming off of this holiday travel season?
Easier or harder to get than the Omicron original variant?
It's a great question. I was just on the phone with the CDC before coming on here, and, we don't have an answer. Is this more transmissible? Does it cause more severe disease? Yeah. Are the symptoms any different? This is still a little bit new, so we don't know. But the good news is, with every variant we've had so far, the vaccines have stood the test of time. Standing up against hospitalization and severe disease. So even if we see a rise in cases, we're hopeful that that rise in hospitalizations and deaths can be minimized as much as possible.
Now, I did see some reporting that said that this particular subvariant could have sort of maybe evade those boosters a little bit better. Is that true?
Yeah, it is true. We have some early data out here showing that, especially those who've gotten the first line of boosters before the bivalent boosters, they don't hold up too well against this variant. Now, the good news is, there was a study out of Emory University this week that showed if you do get that bivalent booster, the new booster, which frankly a lot of people aren't getting right now, but if you do get that booster, you do have some added protection against these XBB variants that we're calling.
I know.
Yeah.
I know.
I mean, just honestly.
Every day.
Better news next time you come, please. I mean, it really is depressing. I think people are like, enough. We've done it already.
I know. We're seeing it over and over again.
Yeah. How do you keep yourself protected when you feel like sort of I give up?
Fatigue.
Yeah, I mean, I'm part of this too. We're all, I think, kind of over the respiratory viruses, the flu, the COVID, the RSV. Now we're seeing a rise in strep infections too. So how do you keep yourself protected? 1 in 3 people over the age of 65, this is the group we're really worried about, have gotten the bivalent booster, the new booster. So, if you are somebody who hasn't gotten it yet, especially if you haven't had a recent infection, go out and get it right after the show. It takes about a week to work, and it's well worth it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.